3 years ago, Dr. James King won a modest amount of money as a result of placing a winning bet in a horse race, and he used the money to purchase some shares in the pharmaceutical company P-Cure. Recently, Dr. King was approached by P-Cure and was asked if he would be the global principal investigator for a trial the company wished to conduct, in which he would be responsible for recruiting approximately 30% of the total number of participants. Naturally, Dr. King is extremely pleased because this is the first large clinical trial involving the academic institution where he works. After accepting the offer, he submits an application to his EC and also completes a conflict of interest form in which he states that 3 years ago he had invested $100,000 in shares in the pharmaceutical company currently sponsoring the trial. Dr. King invests the $100,000 winnings from the number 7 brown horse on which he placed his bet into P-Cure. Now he has been offered the chance to serve as the global principal investigator for a P-Cure trial. The EC chair asks the EC members, "Is there a possibility of the risk of Dr. James altering the data so that the drug trial is a success and that eventually his stock shares will increase in value?" In my view, this is highly unlikely. The value of the shares is not likely to increase due to the positive results from one single trial. Maybe the value will increase when the test article receives approval for distribution and marketing, based on the results of many other trials of which Dr. King has had no possibility to exert influence. Note: one international company developed a drug that became the leader in sales for several years. The initial results of the clinical trials were published in 1985 and 86, but it was not until several years later and after many additional trials that the drug received market approval in the US, and the shares of the company increased in value.